folks returning back from lunch as well. I'm Ashish. I'm the CEO and co-founder of Dina, a digital care-at-home platform and network. I'm joined today with a great group of panelists, but I thought I would first start by welcoming all of you. It's great to be here in person as we get back to it, but I know that there's many also watching online, so welcome to all of our virtual guests as well. I thought before we jump into this very important topic of innovating with health plans, I would ask each of our panelists to introduce themselves and also your impressive organizations. Sheryl, maybe you can get us started.
Hi, Sheryl Markowitz. I'm the Senior Vice President of Clinical Operations at a plan out of New York called Healthfirst. Been there for a couple years. I'm a clinical social worker by training and have a tremendous passion for long-term care, care at home, and for our members that don't have a voice.
Good afternoon. I'm Steve Wogen. I'm the Chief Growth Officer at CareCentrics. I've been there for about 7 years. CareCentrics is an organization that really is two different businesses. There's a historical business that's been very much focused on commercial space for managing home care networks and home care benefits on behalf of payers. And then there is a newer care coordination function that we play where we're really looking to provide the full array of services that any individual may need in their home as a way to keep people out of hospitals over time. But very happy to be here.
And I'm G.T. Sweeney. I'm a colleague of Sheryl's at Healthfirst. I'm the Chief Information Officer at Healthfirst. I've been at Healthfirst for 7 years, and I think what's important about Healthfirst, in addition to what Sheryl described, I mean, Healthfirst was launched 28 years ago as an experiment, launched by the hospitals of New York. So we're a nonprofit health plan owned collectively by the nonprofit hospitals of New York with a value-based business model from day one. So, you know, it was an experiment 28 years ago with one product and 475 members. We now insure 1 in 7 New Yorkers, 1.7 million members, with a full risk business model, and that, you know, so the hospitals each take risk on a subset of our population. And that value-based business model is about financial incentive alignment, but it really is a business model that breeds collaboration in a way that others, other payer provider partnerships are kind of, I think, still aspiring towards. So I think, perfect for today's discussion as well.
Yeah. Well, welcome to all of you, and thanks again for joining us in this discussion. Sheryl, maybe we could start with you. I'll kind of jump right into it, but you have the luxury of working inside of a very impressive health plan, 1.7 million members across the state of New York. I'd love for you to just give us an inside peek into what are the top priorities for an organization like yours, especially in this time, with COVID and many other things that we're dealing with right now.
I mean, top priority always is care, providing care to members who otherwise don't have care. We have care management for 70,000 of our 1.7 million New Yorkers that are individuals who meet nursing facility level of care. So they have a lot of care. But we really want to expand and have care for everyone so that we can touch everyone in different ways and to offer an easy button, basically, so that our members can access. It's a hard city, right? New York, you have to be gritty to navigate New York. And so we want to make it easier for them, and we want to be really culturally and diversity and sensitive to our members. We have a really diverse population. Over half our membership is primarily Spanish speaking. It is the most diverse health plan in the country. And so we really focus on what does that look like? How do we provide the best care for our members in a way that's really sensitive and that we provide access? It's a hard system to navigate. It's hard to leave your specialist, your primary care doctor, and them to say, you need 3 appointments with these different specialists, and then I have to get on the phone and make an appointment. That's really difficult to do, and so those follow-ups don't always happen. So we're trying to make that easier.
Yeah. Well, one of the things that, just building on that, a lot of the discussion today in the market is around facilitating just a greater sense of collaboration between providers as well as health plans. And I think historically it's hard not to immediately think about a contracting process. So if we put that off to the side for a moment, because that's not what today's discussion is about, but really think about whether it's your LTSS network that you're cultivating or other sorts of networks of partners. How do you think about the role of a home-based provider relative to some of your top priorities today?
So, I mean, we get presentations all the time. I get asked all the time, do you want to see this? Do you want to hear this? And we have a lot of gates when people come and do a presentation. I think the first gate for us, honestly, is, are you a company that understands diversity and equity? Healthcare access and equity for us is number one. So if you come and say you don't have any of your materials in Spanish, we're done before it even starts, because it's not helpful for me. And we really want to focus on what we call concordance. There's a whole new body of literature on. If you see a provider that looks like you connect with them, right? So if I move to a new city, I may want to see a middle-aged woman as my doctor and not a 12-year-old, right? I want to see someone who I can connect with. Well, that's the same with people of color, people of all different ethnic races and groups in New York. If there's someone who's Haitian and wants to see a Haitian doctor, the beauty about New York is that I actually can connect them, right? That is an amazing thing that we can do. So we want to focus on that. And that's the same for home care. Look, if people age and get sick, they want someone that they feel safe with, right? I can tell you that my dad and my mom, they wanted providers in their house that look like them. They don't want a stranger. And the older they get, the more rigid they get about that. So, sometimes you're embarrassed, like, oh gosh, please don't say that. But it's the truth, right? It's just the truth. And so that concordance for us is something that's top of mind always in everything that we do. And we think you get more stickiness with our members, and they are more attached to their providers, all different type of providers, home care providers, doctors, all at any level, if you feel safe. And the other thing that we can add to that is, even if you can't find someone who looks like them, we want to make sure that our providers have meaningful bias training so that they understand what that's about. Because in every city, you're not going to find someone who looks like you. But you should absolutely be trained and understand what those biases are so that you can provide more accurate, targeted, better quality care.
Yeah, I mean, it just made me reflect. I think I now understand, but I felt like for the first 16 years of my life, all my doctors were Indian, and I'm not sure.
Yeah,
I never really understood why. Maybe all Indian people were doctors, but I think I now understand. It was definitely my parents looking for somebody who looked like us at the time. So the role of home-based care is increasing in importance, but they need to match the needs of your membership. They need to be able to understand it. Steve, I wanted to pull you into the discussion here for a moment. I think you touched on this in some of your introduction, but CareCentrics is an organization that's been around for a long time, and it seems like it's in the midst of a transformation, especially as the market has evolved over time. You're a convener of home-based care across the entire country. You serve many different health plans, but I would love for you to kind of take us through just maybe a little inside peek into how is CareCentrics evolving or transforming its business model.
Yeah, I'm happy to. So CareCentrics needs to evolve with the industry, and we know that. We grew up as a commercial-based organization, and on the commercial side, what matters to a health plan? It's access and it's cost. And the home health costs get buried in someone's P&L down in an ancillary or other services line. That's the way it's always been, right? Nobody was paying much attention. Obviously, on the Medicare side, things are really different. And I heard some of the conversations this morning about move to value-based, and we absolutely have to do that. And what we believe is that CareCentrics can be a facilitator in helping that happen. But also leveraging and empowering the home and healthcare in different ways, in ways that even 3 years ago, nobody would have thought possible, right? The home has been really the off-ramp from an acute care facility for many, many years. You could turn that around, right? The acute care facility should be the off-ramp to the home. And if you can raise the acuity of the services that you're supporting in a home setting, and in parallel with that, you can better engage individuals in self-care, and telehealth and RPM and new organizations that are intervening in the 911 cycle, which we were talking about at lunch. There's so much power in the home if you can effectively engage those patients. So what are we doing at CareCentrics? There's really three things that we're very much focused on. The first is data and analytics, right? A lot of talk on it, it's hard to do. We have 25 years of data. We collect data real time from the home. And what we're trying to do is determine what patients can successfully heal, age, die in their home in some instances with the right services around them. And then what are those services? What do those services need to be? The second is really logistics, and it's closed loop logistics. And it sounds terrible to talk about it in logistics. Our CEO hates when I say it, but in reality, it's about how do you, if you can identify what the patients need in the home or what the caregivers need in the home, how do you then connect them effectively to those resources? How do you connect them to the right provider? How do you make sure it's there timely enough? How do you appreciate the cultural competency angle, which is so critically important? How do you appreciate the fact that in New York City, if somebody needs incontinence supplies and they live on the 17th floor without a doorman, that they're actually going to get them? So those logistic problems, they're hard to solve, very hard to solve. And it takes manpower to get it done. But it's necessary to move to really our third priority, which is transitioning things to more of a value-based care model. It's not going to happen overnight. You know, most of your organizations are trying to work with multiple health plans. Every health plan has a different kind of perception of what value-based looks like. Do you include readmissions? Do you include ED avoidance and how you structure those contracts? I mean, one of the things we're trying to do at CareCentrics is bring some standards to how a health plan may think about that. And then working with the providers in a very different way than what we have in the past to connect them to the health plans with more of a unified model. And if we could do that successfully, it streamlines the work for everybody involved and it drives more value to the system and it helps us accelerate the push towards value-based much more quickly. But it's going to be a journey, and part of making it real is technology. It underpins it all as the enabler to make it work, which is why I'm glad we have GT and others, because that gets a little bit outside of my expertise.
Yeah, well, it's fascinating. I mean, I appreciate both of your comments, but it does seem the unique opportunity that we have right now is this shift into the home, and obviously we're all here at this event because of that, but technology really makes a lot of that possible. And GT, as a CIO of Healthfirst, you've got the unique challenge of trying to keep up with where the market is headed, but also maybe stay ahead of it a little bit. I'd love for you to sort of share your perspective, the types of things that you're seeing. What role does technology play in all of this?
Yeah, sure. And yeah, it's a big challenge. It's a big opportunity. I think, we increasingly think about making healthcare easier for consumers, right? Like I'm probably everybody in this audience, it would resonate that the experience you have with whoever your health insurance company is. If that was the set of capabilities you had with your bank, you'd choose a different bank, right? So how do we make healthcare easier for consumers? So we have a role in that, and I think everybody in this room has a role in that. We all have to be committed as an industry, I think, to doing the thing we do well, but also increasingly being committed to participate as part of an ecosystem that makes healthcare easier for consumers. And so all of us have these barriers, but we serve the underserved of New York with the highest quality health product in every product that we're in. The members we serve have all these social determinant barriers to address, and so if they're trying to recover at home, we've got to make sure they don't have mold in their home or rodents or infestations or whatnot. So we spend a lot of time on integrating not just the home healthcare workers, but these resources that address these social determinant barriers. And so I think this focus on making healthcare easier for consumers is really important. That using technology to drive collaboration, I think the time is now in healthcare. It's happened in other industries. I think the next 5 years are going to be characterized by this digital disruption, changing the way everybody participates as part of the ecosystem to make it easier for consumers. But if we're going to make it easier for consumers, we got to make it easier for those who deliver care as well. And I'm talking about the home health care workers. I'm talking about the primary care doc specialists. I'm talking about the unpaid caregivers, who do yeoman's work, and yet the entire industry makes it difficult for me to help look after my mom. So I think that's the technology. Now is the time over the next 5 years for technology to make things easier for consumers and make it easier for everybody who participates in the delivering of the care.
Yeah. I want to follow up on that because I've been in healthcare IT for almost 20 years now, which it's kind of hard to say. I'm used to being like the young guy in the room. But this, I think this entire journey has always been, well, can't everyone be on one platform? Yeah. Can't, you can pick an EMR company and say, can't they just run it all? Yeah. And but I think when we think about home-based providers, I mean, there's just a plethora of solutions, including some folks that haven't yet started that technology adoption. How do you think about that at Healthfirst with your vision? Yeah. I mean, how do people play with Healthfirst?
Well, I think when every company, it's about being relentlessly focused on the consumer, delivering something of value to the consumer, and then increasingly in a platform economy, a digital economy as a platform economy, and making intentional decisions around what platforms you want to participate in, what platforms you want to own, but also recognizing that those decisions have to be flexible ones too, because the market's going to evolve. We're at a period with significant investment that's driving the disruption, and then we will need to go through a period of consolidation where acquisitions drive consolidations. There are winners and losers. I think there has to be. But all the winners are going to be those who do something do the thing they do really well, and also are committed to being part of the broader healthcare ecosystem, collaborating.
Which means complying with your APIs or whatever your programs and standards
Embracing
are.
industry standards. Like we're an early adopter of FHIR standards. They need to continue to evolve. We're a small regional health plan by compared to the big nationals. But our biggest competitor market is United Healthcare. We've doubled our IT budget to $200 million, and they spend $3 billion. It's just like, but the cloud is a big equalizer. The internet's a big equalizer. Yeah, I mean that's the way I see it.
When I think of the models for both of your organizations here today, no one provider has enough scale to be able to serve all of your members across both of your organizations. There's some that have some market share, but if you add up the top 10, there's not enough density. So this role of a convener or a network certainly comes to mind. That's partially what Dina is trying to do, is make it easier for plans and systems to partner with many different providers. Steve, I wanted to ask you, just given the fact that you organize over 8,000 home and community-based providers today across the U.S., many of those providers are probably in the room here today. When you think about your core business model, both legacy and where it's headed, how do you think about differentiation in all of those providers? Because everyone in this room here today is thinking about how they stand out in the crowd, but I'm curious on your perspective on that.
Yeah, and I have kind of two different answers to that question. So as Ashish said, we have a network of about 8,000 providers. That's home health, home infusion, home DME. We're expanding to include nurse practitioners. We're expanding to include home health aides and personal care assistants as well into that network. So it will continue to grow. But there will be consolidation. I heard it this morning, in a number of cases where networks are going to narrow. And some organizations are going to survive and some are not. Today, a lot of health plans that we speak with use CMS star ratings as the criterion. They used to do that on the skilled nursing facility side. I mean, we work with health plans that have cut 60% of their skilled nursing facilities out of their network. Now, I don't think they'll ever be able to do that on the home health side, but home health agencies are going to have to differentiate themselves. And from my perspective, and with some of the work that we're doing with some of the agencies, it's going to come down to demonstrating outcomes. And to me, that's the number one thing that needs to get done. Outcomes are going to be critical to differentiation. Outcomes are going to be critical to going into a value-based contract. And when I talk about outcomes, it's total cost of care. First and foremost, I think it's patient engagement and patient satisfaction is kind of the second, and that includes the cultural competency piece. That means being able to get at the data more real time. That means being able to work with organizations or consulting firms that can help you analyze that data so you can report that back to a health plan so that it's meaningful. So underneath that is technology, and that'll be absolutely critical. So answer number one is you need to focus on outcomes and demonstrating those. Answer number two is you need to think through partners and or invest in some of the technology to be able to collect that information and be able to do that reporting in more of a real-time basis.
So just kind of summarize aspects of it. They need to be digitally present, and if I build on GT, your point, whatever solution you choose, we hear a lot about interoperability, but it is now in this wave of interoperability in the market, it's table stakes. You really need to think about how are you present in the market? How do you communicate what you're capable of doing? Because you may not be a fit for every single person that has a need out there. And then how do you share information ultimately back to that organization? So table stakes sort of moving forward. Yeah. Steve, you touched on this notion of star ratings for a moment in quality from a home health perspective. I'm going to take us to a different part of the discussion, which is there's this emergence of supplemental benefits that are emerging, specifically around Medicare Advantage. And Sheryl, I know that Healthfirst also, in addition to being a great plan for Medicaid members, you also offer a Medicare Advantage product into market. How do you think about quality with organizations like personal care agencies that are not yet rated by Medicare on a 5-star basis?
That's a two-part question.
Yeah, two-part, sorry.
So one of it is, I mean, yes, there's a lot of supplements. Everyone's doing that. We have a really robust over-the-counter card that our members can use, and that has some direction around it. So if you are a diabetic, we may lean you to things that would be helpful to have at home. If you have a physical injury, something that you could use. So it's got some structure to it that is different for many plans, and we're continuing to build that out. So that's one. Two is for quality, obviously for us. Like, we measure that all the time. I mean, we get complaints all day long from people who have home care services, right? I didn't like what someone wore. I didn't like what they smelled like. Like, you hear these complaints all day long. Well, if you can manage some of that, right, and the quality really does reflect that you are being sensitive to the members, that's a better fit for us. Because otherwise, there's a lot of work for us on the other end of it, trying to undo all that. So, you know, again, it goes back to the sensitivity of where you are, and it goes back to the response. You know, how quickly can you turn over if there's an issue? How nimble are you when someone says to you, hey, I need you to do this? Are you at the table, or are you defensive? Are you willing to make the change? We're all moving all the time. I mean, we are all in the middle of the room. There is none of us that are on one side or the other at this point. And can you just stay with us and make the changes needed so that we can have good quality, because that's critical, right? Mm-hmm. And that we can be flexible in an environment that's just changing so much.
Yeah. It just seems like one of the things I'm reflecting on all of these comments is, absent a standard for rating quality on a service like this, that the market, and if you're a provider in the market, you should really take control of your data and your service and really take an active role in communicating that versus waiting for an upstream partner to dictate it to you. It's always better to come prepared with your own data. And that likely means investing in that ahead of the curve before perhaps you're getting paid for it, quote unquote. Just kind of wanted to stay with this topic around supplemental benefits for a moment. Steve, with CareCentrics, a lot of what you've done over the years is, whether it's organizing home infusion networks or home health, durable medical equipment, it seems like a core skill set here is playing this role of convener, trying to find the very best providers on behalf of your health plan customers. Is this an area of interest for CareCentrics as it evolves into its next phase?
Yeah, so we've already started moving into the personal care assistant, home health aid kind of thinking and process. And as we do more and more in government programs that's supporting Medicare Advantage plans and supplemental benefits, but we also now are launching a full-blown home and community-based services, LTSS solution as well, working with those plans to make sure we're coordinating and mobilizing those services in the home for the most vulnerable of members that could need service. So we're definitely very focused on that. And the quality, I mean, it is a massive challenge. And we're starting with just patient satisfaction, right? I mean, just start really, really simple. You know, I'd love to standardize some of the outcomes and things. It's going to be harder to do, and it's going to take some time. But just starting with basics. Was the individual happy with the service is a great way to begin.
Yeah, I'm just looking at some of the live questions coming in. One of the ones that came up to the top here is, what are the most important outcomes to measure and differentiate? Again, it feels a little bit different than a traditional home health service around improvements around ambulation or pain management, things that CMS has already put into place. But when it's a non-medical service capability, it seems like we're really looking for some of the softer outcome measures here that may not be out there. So unpacking patient experience.
Yeah, I think that's absolutely correct. Would you agree with that, Sheryl?
Yeah, I mean, if I was queen for the day, and he knows I love the queen, yeah. I think that if you are going to someone's home, we should not be paying you to sit and watch TV for 8 hours. We should say, did you get Sheryl up to make her lunch? Did she take a walk? And measure that, right? Measure the interaction so that people are just not sitting and getting worse. How do we have people be the best they can be no matter where they are? I want a home care company that's going to push some of that, that's going to do something innovative. Like we walk to the mailbox today and then we document that instead of watching TV for 8 hours.
Right. I mean, well, and one of the things that we're seeing kind of go nationwide right now is electronic visit verification. And
Which
beyond just managed Medicaid, but I think we're going to see this for many different types of home-based services. But it sounds like there's an opportunity. Again, don't wait for the 5-question standard to evolve. Start to proactively think about what's already happening in the home and use that to your advantage.
And personalize it too, right? So on the LTSS front, so most states are getting more and more sophisticated on building out that plan of care up front. And there are organizations that are now beginning to interrogate what those plans look like on the back end. It's more of a UM type approach to managing home and community-based services. Maybe it makes sense, maybe it doesn't make sense. But those plan of care should be digitized, right? And there's no reason you can't say, in order to have these services, there are 5 things you need to do. They need to have a bath, they need to have food in their house, and they need to eat it. And they need to be able to get up 3 times a day and just bang, 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 and make sure those things have happened. It's taking service validation to the next level through technology.
Yeah. I think digitized and shared. And I think there's, again, there are parallels in other industries. One fun one here is, like the way the NHL measures, players is the goal plus minus goal ratio while they're on the ice, right? I think there's a parallel there for everybody who participates in the healthcare ecosystem. We will find ways to measure who's around better outcomes, right? Because you oftentimes you can't connect. Like we even deal with this internally. Like to get a positive clinical outcome and a positive financial outcome, it is often true that multiple constituencies have to come together. And if people are arguing over credit, that's not the most productive use of resources. But if we start to measure who's involved in outcomes that are more positive, and then we'll understand what specific things are they doing that are contributing to those positive outcomes, then we'll start kind of replicating those behaviors across the entire ecosystem, presumably.
GT will stay with you for a minute. I'm watching the shot clock, and it's coming down here. One of the fun parts of being up here. But I wanted to give all of you an opportunity to sort of just share some of your final thoughts with the audience as we think about, we have home-based providers in the audience. They can range from people who do physician house calls all the way through to personal care. Any advice to them as they think about sort of participating in this next generation of care?
Yeah, I mean, I think just embracing, of course, as a technology guy, I think embracing this notion of digital disruption as an enabler, but as an enabler of the next generation of collaboration, making it easier for everybody who participates in the care ecosystem to make it easier for consumers as well. I mean, I think that's the orientation I would have.
Yeah. Steve?
Yeah, I've said it a couple times. I mean, it's focused on the outcomes and the data. You need to sell yourselves on value. You need to start by collecting those metrics that are most important for organizations to be measuring.
Yeah.
And
Sheryl?
for me, I'll go back to it. I think cultural and ethnic sensitivity and understanding diversity and understanding that our world is not the same post George Floyd, and we must attend to the world that it is. And we owe our members that type of sensitivity. We owe them that kind of understanding that their world may be a little different than yours and that you want to attend to that.
Yeah. Well, as I think about the whole discussion, again, all my years in this space, I think we all would love a single platform that sort of ruled the world and made everything simple for every aspect of the care continuum. We're just not there yet, which means that as you take control of your data and your initiatives, you may need to do things that are not yet standardized, and that's okay. And that may not feel exactly perfect, but let's not have perfection get in the way of progress. Same thing goes with technology. You may be asked by not only Healthfirst or CareCentrics, but other partners to participate in other types of initiatives. It would be great to have one, but unfortunately, I don't think that's the way our market works yet right now. So be open and flexible, I think, is the thing that we think about every single day. So we're down to the last 30 seconds. I think we've hit some of the FAQs. We'll be around after the discussion today, but just wanted to thank all of you that are watching online and those of you that are here in the room today for the opportunity to participate and listen to our conversation here around innovating with health plans. Thank you.